We're going to have a couple of presenters this morning. We're going to have Director Scott Bookman, our COVID-19 Incident Commander, and Dr. Rachel Herlihy, our state epidemiologist here at CDPHE. And we'll go ahead and get things started with Director Bookman.
Thank you, Brian, and thanks to everybody for joining today. The weather is getting colder. We're seeing snow for the first time in our lovely state today. And it reminds us that our holidays are just around the corner. And we really want to make sure that people are thinking ahead about how to be fully protected for the Thanksgiving holiday. And we put this information out on social media earlier this week, but a reminder for those who want to be fully vaccinated by November 25th, actually need to get your first dose of Moderna vaccine yesterday. And for those who are 12 and older and would like to go for the Pfizer vaccine, you've got until October 21st to get your first dose of vaccine. And then obviously the Johnson & Johnson, which is a one-dose vaccine for those who are 18 and older, November 11th is the deadline to get that shot. So really want to make sure that people are thinking about the safest way to celebrate our holidays this year. And obviously the COVID vaccine is the best way to be fully protected as we move into the holiday season. So next slide. We've talked a lot about the unvaccinated over the last several weeks. And we know that people who have not received the vaccine yet may still have a lot of questions. We really want to make sure that we are doing all that we can to answer everybody's questions and provide the information that they need to ultimately make the decision to move forward and get vaccinated. And so our website provides all of the research and safety information on the 3 authorized COVID vaccines. We have detailed answers to more than 80 frequently asked questions. And then, of course, we have our toll-free vaccine hotline where assistance is available in 350 languages, and we can answer all of your questions. We really want to give all Coloradans the information that they need to move towards getting this vaccine. Next slide. And one particular feature of our website that I do want to call out is that there is an interactive chat feature that is available in a multitude of different languages. Again, providing a different way for people to ask questions, get the information that they need to understand everything that they need to know about this free, safe, and effective vaccine to get people vaccinated so that we can end this pandemic. So I just wanted to start with that. I will turn it over to Dr. Herlihy to give her update, and then I'll be back a little bit later on. So Rachel.
Good morning, everyone. Thank you for being here. So this figure shows you our case trends over time, and this particular figure shows week over week changes in our cases here in Colorado. The weeks that are shown in red on this figure are weeks where we've seen a week over week increase, and weeks that are shown in blue are weeks where we've seen a week over week decrease in cases. Also important to keep in mind that the last bar shown here in blue with the decrease of 53% is this week's data. So there's obviously a decrease there because the week's data is still incredibly incomplete because we haven't even gotten to the end of the week yet. But I wanted to share this data with you because I think it helpfully illustrates this extended high and stubborn plateau that we've been in for many weeks here in Colorado. So you can see that for the last 6 weeks or so, we've been in this high plateau of cases. And if you look at the last 2 weeks in particular, you can see that 2 weeks ago we saw a 5% week over week increase, and last week we saw a 16% week over week increase. So we have a clear increasing trend now for the last 2 weeks. And you'll see that last week's case counts are really the highest that we've seen since January. So certainly concerning trends that we're seeing here in the state right now. Perhaps a little bit of improvement this week so far. But really what I'm going to be looking for in this data to feel confident that trends are stabilizing or ideally even reversing is multiple weeks of declining case counts. And we're certainly not there yet, even if we see a slight improvement as this week goes on. It's really going to be, I think, not until we see multiple weeks worth of declining cases that we feel confident that that cases are on the decrease here in Colorado. Next slide, please. And as always, we see quite a bit of variability among age groups. So this figure is showing you case trends by age group. You can see that the adults are shown in the teal color, and then our pediatric age groups broken into 6 to 11, 12 to 17, and 0 to 5 are shown here as well. As I mentioned previously, we have seen a slight improvement. So honestly, just three days or so worth of case improvements. Again, I'd like to really see that trend continue for multiple weeks to feel confident that we're seeing a decline in cases right now. But as we've seen for many weeks, the rates continue to be highest among our 6 to 11-year-olds, followed by the 12 to 17-year-olds, followed by the adults. And then the lowest rates continue to be among our preschool age children, so 0 to 5-year-olds. And again, you can see that we have seen this resurgence over the last 2 weeks of those cases with just a slight improvement in the last couple of days. Next slide, please. And just like we right now compared to the rest of the country. This is a figure that I often share with you. And if you recall it from several weeks ago, what you'll recall is that for many weeks, Colorado's trends and cases have really been towards the bottom of this ranking. So this figure shows you case rates from highest to lowest by state across the country. And for many weeks, Colorado was at the very bottom of this scale with some of the lowest rates that were being seen in the country. Unfortunately, that trend has changed in the last 2 weeks. And you can see that now we are the 14th highest in the US, including DC. And that's really a significant change for us. And there's two things that are really driving this. One is the fact that Colorado has seen an increase in cases over the last 2 weeks. But what is also occurring and increasing our ranking here is the fact that many parts of the country are seeing declining trends right now. So while we're seeing this increase in Colorado, most states in the country are now seeing a decline in cases. And that's obviously what we're hoping we're going to see here in Colorado in the coming weeks, but difficult, of course, to know if we're going to continue to see an increase or decrease as time goes on. As always, the pandemic continues to be quite unpredictable. And with that, I'll turn it over to Director Bookman.
Thank you, Dr. Herlihy. And just to follow up on that, yesterday we had 982 people hospitalized in Colorado with COVID. And that is actually the highest we have seen this entire year. We actually have to go back into December of 2020 to find a time that we had more people hospitalized with COVID. And so this is a stubborn plateau. Hospitalizations are continuing to rise, and it is really important that we continue to do all that we can to protect our hospital capacity. So on the next slide, we'll talk again and really compare, the hospitalizations vaccinated versus unvaccinated. And as of today, 78% of those who are currently hospitalized are unvaccinated. And so really do want to encourage people to take advantage of the information that we have available and really educate themselves, understand these vaccines so that they can move towards making the decision to get vaccinated. Next slide. And so this is a 30-day trend line looking at our ICU utilization over the last month. And what we see here is just this continued upward trend in the percentage of ICU beds that are occupied. And this is for COVID and for non-COVID patients. But as of today, we are at almost 90% of our ICU beds being currently utilized. So next slide. We have talked a lot about the COVID vaccine, but there is also another really important vaccine out there to help us protect our hospital capacity, and that's the annual flu vaccine. And so I really want to take the time today to encourage all Coloradans who are eligible to get this annual influenza vaccine. You can get it at the same time that you get your COVID vaccine. everybody who is 6 months and older is eligible to receive it. These flu shots are widely available in doctors' offices and pharmacies. You don't need a doctor's note or a prescription. And for those who don't have health insurance, we have information on our website about where you can find free or low-cost flu vaccines. And so the COVID vaccine, the flu vaccine, you can get them together. Taken together, they really do have the opportunity to protect our hospital capacity as we go into our winter months. I think that's my last slide.
Thank you, Director Bookman and Dr. Herlihy. We'll go ahead and open things up for the media Q&A portion of this morning's avail. A couple of housekeeping items. We'll use the raise hand function in order to request a chance to ask a question. We'll start with first questions first. If we have time, we can get to follow-ups or second questions. And before you ask your question, if you could please state your name and the outlet, we would very much appreciate that. Let's go ahead and get started with Meg Wingerter. Go ahead, Meg.
Hello, this is Meg Wingeter from the Den. You talked about wanting people to plan ahead in terms of making sure they're vaccinated by Thanksgiving. And the CDC had laid out some possible changes people could make to try to gather more safely. Are you recommending at this point that people do their holiday plans other than get vaccinated if they haven't?
This is Rachel, I can take that question. So there are a variety of strategies that we know can be used to decrease the risk associated with gatherings, whether those are gatherings for holidays or anything else. And so some of those strategies, of course, include mask use, social distancing, having events outside instead of indoors when possible. If events are occurring indoors, you can improve ventilation in a number of ways, including simply just opening windows. There are also, we can recommend that gatherings be limited to individuals who are vaccinated, among those that are eligible for vaccine. Of course, kids are too young to be vaccinated at this point. There's also testing options. So their hosts can encourage individuals to be tested prior to an event. So I think there are a variety of strategies that people can use to decrease the risk associated with having gatherings. Smaller gatherings are always going to be lower risk than larger gatherings.
Are those the just general, if you want to lower your risk, here are some options versus, or these things that you're really encouraging people to do?
Yeah, so I would say that we are encouraging individuals to decrease their risk of exposure to COVID-19. And that's not just for holidays, that's all the time, right? So we want individuals to protect themselves, protect their families, protect their community. And there are lots of important ways to do that. There's also, I think, important travel guidance that CDC has on their website, and certainly would encourage individuals that are considering traveling for the holidays to look at that guidance and look at risk of exposure, decreasing risk of exposure to COVID-19 while traveling.
All right, let's go to Chris Vanderveen. Go ahead, Chris.
Chris Vanderveen with 9 News. Thanks, Scott and Rachel, for the update. I'm just curious, that's sort of the $1 million question right now. How sure are you that we're at the sort of the top end of a really stubborn plateau, as Scott, as you use that term, or is there the possibility that this is the start of sort of a November, December wave? I mean, basically, how comfortable do you feel that we're at a plateau as opposed to a start of another wave?
Yeah, great question. And I really wish I had the answer to that question. Yeah, this is one of those times where my epi crystal ball isn't very clear. I do have concerns that we could see an increase in cases as time goes on. I'm certainly hoping that Colorado could follow in the direction of the rest of the country that is seeing a decline in cases right now. But that is a little bit counterintuitive to what we know about respiratory viruses in general. Typically, we see respiratory virus season, so influenza season, RSV, other respiratory viruses. We really see that season start in the fall and really increase through the winter. But COVID's unpredictable. And I think we've seen these waves of COVID-19 here in Colorado and in the country that haven't followed typical respiratory virus epidemic norms. So I think it is challenging for us to know what the next couple of weeks and months have in store for us. But I think it is an important reminder that, COVID is still here and we continue to need vaccine and all of the strategies that we've been using to control transmission and limit our risk.
All right, Vinny, go ahead.
Good morning. This is Vinny Del Giudice at the Bloomberg News in Denver. In addition to the Delta variant, are you seeing any other variants in Colorado emerging? And once the Delta variant calms down or dips, do you see any other variants out there that pose a serious threat? Thank you very much.
At this point, based on our Sentinel laboratory surveillance work that we're doing here in Colorado, 100% of what is circulating in Colorado is the Delta variant or a Delta variant sublineage. So these are very closely related lineages to the Delta variant. At this point, we really haven't seen any other variants emerge that appear to have characteristics that are going to allow that variant to outcompete Delta. We're paying close attention to case reports of other variants as those variants are identified across the globe. But again, at this point, nothing appears to be displacing Delta.
Thank you very much.
Okay, let's go to Marissa Armas. Marissa, go ahead.
Hi, Marissa Armas here with CBS4. I know you kind of spoke about this already, but if you could just reiterate, why exactly is Colorado, why are these cases going up here in our state, but the rest of the country continues to decline? Is it because, we're a colder area and more people are spending time indoors? I know we're seeing kids, but if you could just reiterate why exactly we're kind of going the opposite of where the rest of the country is going.
It's difficult to know for sure. We do know that there is probably some element of seasonality with COVID-19, just as there are with all respiratory viruses. So that's probably part of the story, that we could have potentially seen an earlier wave of illness in the Southeast associated with warmer temperatures, people being indoors and air conditioning, when the opposite might be true here in Colorado. But again, the experience right now isn't uniform in colder northern states that we're seeing an increase in cases. I think there's a lot we still don't know about the temporal nature of these waves of illness and how they occur with Delta. So I think really lots more for us to learn and try and understand. And at this point, we're certainly hoping that we're going to see some stabilization in the numbers here in Colorado and see a decrease, but again, difficult to predict at this point.
Let's go to Rachel Estabrook. Go ahead, Rachel.
Hi. What would you say to people, particularly over 65, who are anxious to get their, who had Moderna or J&J and are anxious to get their booster shots? Anything you can tell them about, getting in the queue or anything like that?
Scott, I'll take that one. We are excited that the FDA and the CDC are likely moving forward with formal recommendations on Moderna booster shots and booster shots for J&J, hopefully today. And we have plenty of vaccine available in the state. We have thousands of providers available in the state to administer the vaccine. All of the information is on our website. We encourage Coloradans to take advantage of this booster the moment it becomes available, and we're going to do all that we can to help them get there.
All right, do we have any other first questions from anybody in the room? All right, then let's go back to Chris Vanderveen. Go ahead, Chris.
Yep, thanks for an additional question. Chris Vanderveen with 9 News. It looks like you're going to be really, really close to 1,000 patients today in Colorado hospitals. ICU utilization is obviously, I believe you said last time, 40% of ICU patients are COVID positive patients. Are you contemplating any contingency plans, particularly for metro area hospitals and northern Colorado hospitals that are quite full right now, in terms of those contingency plans that you contemplated last year? Are any of those sort of beginning to be thought about right now as we sort of enter into the winter?
We put a lot of these plans into place last year, Chris, and thankfully didn't need to fully utilize them. But, all of our partner hospitals in conjunction with Colorado Hospital Center. We've created this combined hospital transfer center that is designed to maximize every ICU bed and every medical bed that we have in the state. And so the hospitals monitor this on a daily basis. We are working closely with them. And if we do need to start moving patients, larger distances to take advantage of every bed available, we have the tools in place to do that.
Right, let's go back to Marissa. Go ahead, Marissa.
Thank you. Marissa Armas again with CBS4. Also, I know a lot of our cases are coming from kids right now. So do we foresee having to close schools again because of these rising cases we're seeing in children? And also, what do parents need to do at this point to protect their kids?
This is Rachel. I can take that question. So we are certainly looking forward to FDA authorization of the vaccine for children 5 to 11 years old, and think that's obviously going to be an important step in protecting our children. But at this point, most children, anyone under the age of 12 years old is unvaccinated at this point. And those kids are really more at risk now due to COVID-19 in the pandemic than they have been really since the beginning of this pandemic. And so their risk is quite high still, and their risk of exposure is quite high. And so I think parents need to, continue to use all of the strategies that they've been using to reduce the risk of exposure for their kids.
All right, let's go back to Vinny. Go ahead, Vinny.
Thank you. This is Vinny Del Giudice at Bloomberg. Any evidence through contact tracing or otherwise whether some of these cases causing the elevation are coming in from Wyoming or other neighboring states where they've had a very serious COVID-19 problem lately? Thank you.
Rachel, I can take that. So we don't have a clear evidence that there are a significant number of cases that are being imported into Colorado from out of state at this point.
Thank you very much.
All right, thank you, everybody. That's going to wrap up today's press conference. If you have any questions that you were not able to ask today or that were not covered in today's media avail, please do email us at media_info@state.co.us, and we'll get back to you as soon as we can with some information. Appreciate you all joining up today and hope you have a good rest of your day and a good weekend. Thanks.